Have you ever found yourself wondering about a really personal practice, something maybe unspoken, wondering if it's truly healthy for you, especially as you get older, past 50 or 60?
We're talking about self-pleasure, right?
Exactly. It's a topic that's often kind of shrouded in confusion, maybe outdated myths, and, well, frankly, there's just not a lot of clear, reliable information out there.
Yeah, it's true.
And if you've ever had that private worry, that little nagging thought that maybe you're causing some kind of, invisible harm to your hormones, maybe your prostate, or even your performance.
You're definitely not alone in that. Research actually shows a majority of men over 60 do continue this practice.
Right, but many are doing it, like you said, completely in the dark.
And that's exactly why we wanted to do this deep dive today. Our mission here is really to cut through that uncertainty.
With an honest, science-based conversation.
Precisely. We're going to walk you through some genuinely surprising benefits of masturbation in maturity, and then, just as importantly, the potential risks you really need to be aware of.
And we're drawing on some solid research here.
Yes, including insights from some groundbreaking research. There's a landmark study from Harvard University we'll touch on. The goal is for you to leave this conversation feeling informed and really empowered about something that's part of many men's lives.
Okay, let's unpack this then. Maybe start with the good news first. Because when it's practiced consciously, it seems self-pleasure can actually be, well, a marvelous ally for your health.
It really can.
So let's dive into that first benefit, maintaining penile health. We think about erections for pleasure, obviously, but what's happening mechanically that makes it almost like physical therapy?
That's actually a great way to put it. The physical act itself, achieving an erection, it dramatically increases blood flow into those spongy tissues inside the penis.
Corpora cavernosa.
Exactly. And this regular influx of blood, the engorgement, it's essentially exercise for those tissues. It helps maintain their elasticity, their flexibility.
Which you need for firm erections as you get older.
Yeah, absolutely crucial for achieving and sustaining firm erections. It's all about keeping that system, in good working order, like keeping any muscle toned.
That makes a lot of sense. Okay, now, something that often gets discussed, maybe in hushed tones, but the research sounds really compelling. The impact on prostate health. How significant is that link?
Oh, it's incredibly significant. We're not talking about just one small study here. There are multiple large-scale studies.
Including that Harvard one you mentioned.
Yes, that groundbreaking Harvard research. That particular study, just to give you an idea, followed over 30,000 men for almost 2 decades.
Wow.
And it found a really clear, strong link. Higher ejaculation frequency was associated with a significantly lower risk of developing prostate cancer.
And the thinking behind that is?
The prevailing theory is that regular ejaculation basically helps to flush out potentially harmful stuff. Old secretions, substances that can build up in the prostate duct.
Sort of like cleaning out the pipes.
Kind of, yeah. Think of it as a natural cleanse for the prostate. It prevents that stagnation of fluids that might possibly contribute to cellular changes down the line.
Wow, okay. That Harvard study alone, the scale of it, really underlines the point. So, moving beyond the prostate, how does this tie into another, maybe overlooked part of our anatomy, the pelvic floor?
Ah, yes. Critical.
We focus on core strength, abs and back, but this is just as vital, isn't it?
It absolutely is. Those rhythmic contractions, the ones that happen during orgasm, they're actually a fantastic workout for your pelvic floor muscles.
Specifically, which ones?
We're talking mainly about the pubococcygeus muscle, often just called the PC muscle.
That's the one you use to, stop urination midstream.
That's the one. And having a strong pelvic floor is vital, not just for, sexual pleasure, but it's really key for maintaining strong erectile function, improving your ejaculatory control, and crucially, preventing urinary incontinence.
Which can become a real issue for guys as they age.
It certainly can. So strengthening that area has multiple benefits.
Okay, let's talk stress. In today's world, who isn't looking for natural ways to unwind? And apparently, there's this incredible built-in benefit here, a direct impact on cortisol. How does that work?
Yeah, this one's fascinating because of how immediate it is. Research consistently shows that orgasm leads to a pretty significant and rapid drop in cortisol levels.
And cortisol is the main stress hormone.
Exactly, our primary stress hormone. So lowering it directly helps regulate blood pressure, it helps reduce anxiety. It basically makes masturbation a natural, readily available tool.
For both mental well-being and heart health.
Right, for cardiovascular health too, by keeping that stress response managed. It's like a built-in physiological reset button, a natural stress reliever.
And it's not just about reducing the bad stuff, the stress hormones. It also floods your brain with some really powerful feel-good chemicals, right?
Precisely. Post-orgasm, your brain gets this wonderful rush of beneficial neurochemicals. You get a significant release of dopamine.
The pleasure molecule.
The pleasure and motivation molecule, yeah, drives feelings of reward, satisfaction. And then there's oxytocin.
Often called the bonding hormone.
That's the one. It promotes feelings of calm, trust, well-being. So this natural surge, this cocktail, it provides a really profound sense of relaxation and contentment.
Which is invaluable for mental health, especially as life throws curveballs.
Invaluable at any stage, absolutely. Great for emotional balance.
Okay, moving from the internal chemistry to something very practical, very external. It actually aids in self-detection of physical issues.
Yeah, this is a point that maybe gets overlooked, but it's incredibly effective and empowering, really.
How so?
Well, the regular practice of self-pleasure just naturally makes you intimately familiar with your own anatomy, your testicles, your penis.
You know it feels normal.
Exactly. So this consistent self-examination means you're far more likely to notice any early signs of trouble. Things like testicular cancer, maybe penile fibrosis, Peyronie's disease, or other little anomalies that might otherwise go unnoticed until they become much more serious.
So it's like an informal but effective health check.
A very effective part of your personal health surveillance, yes.
All right, and for anyone, myself included sometimes, who struggles with getting good sleep as they get older, this next one sounds pretty good. It can improve sleep quality.
Absolutely. That combination of hormone release after orgasm is really powerful for inducing relaxation.
We talked about oxytocin.
Right, you've got the oxytocin surge, plus you get prolactin, another hormone known for promoting that post-orgasmic relaxation and sleepiness. Combine that with the big drop in cortisol we mentioned.
And you've got a recipe for sleep.
You've got a profound sedative effect, basically. It helps the body and mind relax very deeply, making it significantly easier to fall into that restorative, deep sleep.
Which definitely gets harder sometimes with age.
It often does. So think of it as a natural sleep aid built right in.
Okay, so we've talked blood flow to the penis itself. But does it also enhance circulation throughout the whole pelvic region?
Yes, that's a really crucial distinction. The improved blood flow isn't just isolated to the erectile tissues.
It's broader.
Much broader. It benefits the entire pelvic area that includes your bladder, the prostate, all the surrounding muscles. This enhanced circulation helps prevent issues that come from stagnation, from poor blood flow. It contributes to overall pelvic health and vitality.
A regional benefit, not just localized.
Exactly. A comprehensive regional benefit.
Now, for men who might be dealing with challenges like premature ejaculation, this next benefit seems like it offers a surprisingly effective and obviously private solution. It can serve as a training method.
It's a very practical application, yes.
Yeah.
For guys struggling with PE, masturbation offers a safe space. It's private, low pressure. You can practice techniques like the stop-start method.
Without any performance anxiety.
Precisely. This allows you to get a much better feel for your body's signals, the sensations leading up to orgasm, and you can gradually build greater control over that ejaculatory reflex.
And that control can translate to partnered sex.
That's the goal. The improved awareness and control can directly translate into more satisfying, longer-lasting partnered experiences.
Okay, finally, let's bring it back to the brain. You hear it all the time. It's our largest sex organ. And this practice helps keep sexual desire and those neural pathways active. How did that work?
It really does. Think about it. By regularly engaging in sexual fantasy and the physical stimulation itself, you're essentially keeping those specific neural circuits firing.
The ones linked to desire and arousal.
Exactly. Desire, arousal, sexual response. This continuous activation helps maintain a healthy libido, keeps your overall sexual responsiveness sharp, even if you don't currently have a regular partner.
It's like keeping the engine tuned.
Kinda, yeah. It's about keeping those crucial brain-body connections vibrant and responsive, making sure the machinery stays well-oiled, so to speak.
Okay, so we've covered a lot of really positive ground here, some quite remarkable benefits that might surprise a lot of listeners.
Definitely some things people don't often talk about.
But to get that complete picture, we absolutely have to look at the other side of the coin, the potential risks, the negative effects.
Crucial for balance.
Because, as we always stress here on this deep dive, a healthy practice is always a conscious practice. So as we shift gears, what are some of the things you really need to watch out for?
Well, one of the first potential risks, and it's maybe less about the physical act itself, is social isolation.
How does that play out?
It becomes a problem when self-pleasure starts to act as a complete substitute for real human connection, for intimacy, rather than being a healthy complement to your sexual life.
So it's causing withdrawal.
Yeah, if it leads you to withdraw from social engagement or meaningful relationships, the solution there is really self-awareness, making sure it's enhancing your life, not replacing connection.
Got it. Okay, shifting to something more physical. What about skin issues? Micro lesions. That sounds unpleasant, but maybe easily avoidable.
It is absolutely easily avoidable. These are just tiny tears in the skin that typically happen if masturbation is, well, too aggressive or maybe more commonly done without enough lubrication.
Friction burn,
Yeah.
essentially.
Pretty much. It can cause irritation, inflammation, and if you don't take care of it, it could even become an entry point for infection. But the fix is simple.
Be gentle. Use lube.
Be gentle and consistently use a quality water-based lubricant. Reduces friction, protects the skin. Simple as that.
Okay. Then there's this idea of desensitization. That sounds like it could cause real problems, especially with a partner. Is that common? How do you prevent it?
It can definitely be an issue for some. If you stimulate yourself in the exact same way, same pressure, same rhythm, same spot every single time.
Your body gets conditioned.
Exactly. Your brain and body can become conditioned to only that very specific type of touch, which can then make it difficult to get aroused or reach orgasm with a partner because they naturally provide different stimulation.
So the key is mixing it up.
Variety is key. Consciously vary your technique, your rhythm, maybe your focus. Keep those arousal pathways adaptable, responsive to different kinds of sensation.
Okay, this next one sounds like a really critical warning sign. The potential for masturbation to mask underlying causes of erectile dysfunction.
This is incredibly important, a point we really, really want to highlight for you listening.
So what's the scenario?
The scenario is you find you can consistently get an erection during masturbation, no problem, but you really struggle to get or maintain one with a partner.
It might be tempting to just ignore the partner issue.
Exactly, but you shouldn't. This specific pattern can often mask serious underlying health problems. Things like heart disease, diabetes, significant hormonal imbalances like low testosterone.
Wow, so it's a red flag.
It's a major red flag. If you notice this discrepancy, don't just dismiss it. It's absolutely essential to see a doctor. Your body is signaling something important that needs medical attention. Don't ignore it.
That's crucial advice. Okay, sticking with physical issues, what about just bad posture?
Yeah.
While doing it, can that actually lead to nerve problems?
It sounds a bit strange, maybe, but unfortunately, yes. Some men might, masturbate while sitting slumped in a hard chair or hunched over awkwardly.
Not exactly relaxed position.
No. And over time, especially with repeated pressure in that position, it can compress the pudendal nerve.
Which nerve is that?
It's a major nerve in your pelvis. It provides sensation to the genital area, the perineum. Prolonged compression can potentially lead to genital numbness or even chronic pelvic pain down the road.
So the solution is?
The ideal is simple. Practice in a relaxed, comfortable position. Lying down, maybe with some support like a pillow, is often best. Avoid putting undue pressure on that pelvic region.
Makes sense. Okay, beyond the physical, what about the emotional side? The risk of it becoming an unhealthy emotional escape mechanism. How do you know if it's crossing that line?
Right. This happens when it shifts from being, one healthy outlet among others to becoming your only tool or your main tool for coping with difficult emotions.
Like stress, boredom, frustration.
Exactly. When that happens, you can develop a kind of behavioral dependency. You consistently turn to it for a quick fix instead of actually addressing what's causing those feelings.
So it prevents dealing with the root cause.
It can, yes. It's really crucial to have a diverse toolkit for managing emotions. Things like exercise, meditation, getting out in nature, and importantly, talking with people, friends, family, a therapist. It's all about balance.
And on that emotional note, a very real issue for many men is still, even today, feelings of guilt and shame around this, often tied to upbringing, right?
Absolutely true. Many men, depending on their cultural or religious background, were raised with really powerful taboos about self-pleasure, and those ingrained messages can be incredibly hard to shake off, even decades later.
Causing real distress.
Yes. If those feelings of guilt or shame persist, and they're genuinely causing you distress, please know you don't have to just carry that burden.
What's the recommendation?
Speaking with a sex-positive therapist or counselor can be incredibly beneficial. They can help you process those old messages, reframe this natural human practice in a healthier, more self-accepting light, and hopefully liberate you from unnecessary shame. It's about self-acceptance, really.
Good advice. Now, we talked earlier about how infrequent ejaculation might be a risk for the prostate. But is there such a thing as too much frequency? Could that lead to something like pelvic congestion?
That's a great question, bringing up the other end of the spectrum. It's about finding a healthy balance, right?
So, while higher frequency is linked to lower cancer risk.
Right, but excessively frequent ejaculation, and we're talking maybe multiple times every single day, over a long period, can sometimes lead to a feeling of heaviness or aching. In the testicles, the general pelvic area,
Why does that happen?
it's often thought to be due to sustained vascular engorgement, just prolonged pressure and fluid buildup. The solution here, like with so many things,
Moderation.
moderation, exactly, and just listening to your body. If things feel achy or uncomfortable, maybe take a break for a day or two, let things settle.
Okay. And for men, perhaps with their partners who are actively trying to conceive a child, is there any potential impact on semen quality from very frequent masturbation?
Yeah, this is a very specific concern, and it really only matters if you are actively trying to conceive, let's be clear. It absolutely does not harm your long-term fertility or the health of your sperm.
But it can affect counts temporarily.
Exactly. Ejaculating daily or multiple times a day can temporarily reduce the concentration of sperm in each ejaculate. Just simple maths, really.
So if conception is the goal,
For optimal sperm quality and concentration when trying to conceive, studies generally suggest an abstinence period, meaning no ejaculation, of about 2 to 5 days beforehand, whether that's before intercourse or collection for IVF.
so it's a strategic thing, not a long-term health risk?
Precisely. Just a timing consideration for conception.
All right, and finally, a potential disconnection from reality.
Sure.
This often gets linked to pornography use. How does that factor in as a risk?
Yeah, this risk primarily comes into play when masturbation becomes heavily or maybe exclusively reliant on pornography, especially extreme or unrealistic types of porn.
How does that cause disconnection?
Well, constantly consuming that kind of content, maybe overly specialized, maybe fantastical scenarios, can, over time, skew your expectations of what real-life intimacy looks like, feels like, what arousal feels like with a real person.
Making connection harder.
It can potentially make it more difficult to connect emotionally and physically with a real-life partner whose responses and bodies are, well, real and not scripted or edited. The key here, again, is balance.
So if you use visual aids,
If you do use visual aids, try to balance them with your own imagination, your own self-generated fantasies, maybe memories of real, effective, fulfilling sexual experiences you've had. It's about keeping one foot firmly planted in reality.
okay, so wrapping this all up, it seems pretty clear. Masturbation after 50, after 60. It isn't simply good or bad.
No, it really isn't black and white. It truly is a tool, a part of the human experience for many.
And like any tool, how you use it determines its effect.
That's genuinely the core message we hope you take away from this deep dive. The secret ingredient, really, for a healthy practice, whether we're talking about this or almost any aspect of your life, it's always consciousness, awareness.
So when practiced with that awareness, with respect for your body, and with moderation,
Then yes, it absolutely can be a powerful, even marvelous ally for your health and vitality as you age.
Okay, so as you reflect on everything we've discussed today, here's maybe a thought to ponder. If consciousness, awareness, and moderation are so key to making a personal practice like this healthy, where else in your daily life could applying those exact same principles unlock some unexpected benefits? Or maybe just more vitality?
Something to think about.
Definitely something to ponder until our next deep dive.